with a video connection. Ritu, I can't hear you. So just give me 2 minutes.
I don't know whose phone this is. Mom's iPhone. I'm not sure if this is Dr. Daga's phone. Last time.
This part of the program is brought to you by St. Peter's Healthcare System, treating you better for life.
Welcome, listeners. You're listening to EBC Radio. This is 11:70 a.m. Today, we have a special edition of Heartbeat. Heartbeat is an educational program about your health, which airs on EBC Radio. We typically air on the second and fourth Saturday of the month. For any new listeners, we've been airing this program for the last 18 years. Today, we have a special edition in view of the condition with COVID across the globe, especially in India right now. So we thank you for tuning in. You can listen to us live on the web on www.ebcmusic.com. You can also listen to us in Central New Jersey on 11:70 a.m. Today, we're also trying something different where we are streaming the show live on YouTube. In order to get to the YouTube link, go to live.heartbeatradioshow.com, live.heartbeatradioshow.com, and it will redirect you to the YouTube link where you can listen to the show, and later on in the show, you can ask us questions. I am grateful for our esteemed panel, which is joining us today. And the format of the show is going to be where I'm going to introduce everyone. I'm going to go over some housekeeping items, and then each of our members on the panel is going to share a few words about how they see the situation, what they've been through, and I think that will take us to through about a half hour, and then we'll go to question and answers. The show is 2 hours long today. So just to introduce everybody, I'm Dr. Dinesh Singal. I'm an interventional cardiologist. I'm the director of the catheterization laboratory at St. Peter's University Hospital and an attending cardiologist at Robert Wood in Princeton. I'm joined by my co-host, Dr. Meena Murthy. She's the chief of endocrinology at St. Peter's University Hospital. And today on a panel from the US, we have Dr. Balaji Yegneswaran. He is an intensivist and critical care attending at St. Peter's University Hospital. In India, we have an esteemed panel with Dr. Sunil Kumar. He is the Director General of Health Services in the Government of India. We go back a long way from our medical school days. So I am really appreciative of him taking the time and joining us. We may get Mr. Ashish Kundra. He is a senior IAS officer in the government, in the Delhi government. He's an officer on special duty in the health department and principal secretary transport. I know he had some last minute engagement. We're not certain if he'll join, but hopefully he will. We have Dr. Ritu Arora. Dr. Ritu Arora is the dean of Maulana Azad Medical College in Delhi. And like Dr. Sunil Kumar, our friendship goes back to our medical school days. So thank you, Dr. Arora, for joining us. Dr. Mridul Daga, he is an intensivist and director professor of medicine at Maulana Azad Medical College. And he joined us last week on the show, and his input was very valuable. With that, just a few housekeeping items. So we've come up with somewhat of a unique format. I have everybody on the panel on a Zoom link. We're feeding the Zoom link into the radio show feed, and the Zoom link is being fed into YouTube. So anybody who's listening to us and watching us on YouTube, there may be periods when we have commercials every half hour on the radio. And so you may see us talking to each other informally. So you can be part of our group and while we discuss things. So the first half hour, we'll have a discussion amongst ourselves where everybody's going to share in, and then you can ask us questions. You can ask questions on the radio. The phone number in the studio is 732-297-9886, 732-297-9886. That question will probably not get heard by the panel. I will have to listen to your question and narrate it to them. You can also, if you're logged into a YouTube platform, you can send us questions there. Dr. Yegneswaran is monitoring that, and he will share those questions to us. We also have a WhatsApp set up with the same phone number with 732-297-9886, and you can text us messages on WhatsApp. We already have some questions people have asked us, so we'll bring them to the panel. So with that, let me go across the panel. I'm going to let Dr. Meena Murthy, my co-host, say a few words, and then we'll go around. Meena?
Hello to all our audience. And today, I'm sure we have a lot more joining us because we have various avenues. And we are very, very grateful. We are highly privileged to have the highest level of medical expertise and, government lead with us, with Dr. Sunil Kumar, Dr. Arora, and Dr. Daga joining us. And hopefully, we'll have a good discussion that our audience has been awaiting to understand here and know all this dynamic situation, how it's changing, and how much work these people have put in and their teams to change for the better. Thank you.
Dr. Balaji, I know you've been taking care of patients. We went through this whole crisis last year. Things have settled down a little bit in the US. How do you see things in perspective from what happened last year to now?
Thank you, Dr.
Just
Singal.
1 minute if I interrupt.
Sure.
Dinesh, Dr. Daga is asking the permission.
Oh, yes, 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 yes.
Yeah, so you can just have to let him know.
Yes.
Yes, Bala.
Thank you, Dr. Singal and Dr. Murthy. And we are here much better than last year. In New Jersey, as you know, the number of cases have gone down, and hopefully with vaccination, hopefully things will get better and we can get back to normalcy. From New Jersey perspective. India is going through a lot, and I'm sure a lot of audience have a lot of questions, and we are here to answer your questions, and we have people here. I'll try our best to give your answers.
So I'm going to turn to Dr. Sunil Kumar. The whole focus of this show today is because of the situation in India, and you are in the thick and thin of it. So help us, give us a perspective of how things were a few weeks ago, or maybe the last wave which went through, what's happening now, and how are you facing those challenges?
Well, first of all, let me thank Dr. Dinesh and all other colleagues joining us, who have given me this opportunity to give a brief of the situation that we are going through. As you all know that in today's time, the news travels very fast, and what India is going through is known to the entire world. We cannot, the figures are known to the entire world. We were having a reasonably good time, and from the previous year, but this honeymoon lasted very for a very short period of time, I must say, and sooner or later we were engulfed into a huge wave. There may be various reasons for this, for which we can go into the details of that also. However, the last 5 to 6 weeks, perhaps a little more than that, have been terrible. We have been witnessing a huge rise in the number of cases across the country, and the deaths have been numerous. The public has been looking for the help in the government hospitals as well as in the public in the private hospitals, and the government of India, as a representative of the same, we have been trying to put up a brave front, and we have been trying to do as best as possible. We were challenged, we were overwhelmed, but we have also circumvented a number of difficulties in order to help the public, in order to help the suffering people. And we are happy to say that now things are settling down a bit in a number of states, and the situation with particular regard to the availability of the oxygen and availability of the drugs, essential drugs, and the confusion regarding a number of drugs which should be used, should not be used, etc., particularly regarding the national guidelines. We have been trying to make the things much, much clearer so that unnecessary panic, unnecessary chaos is avoided, completely avoided. This is a completely avoidable situation. We cannot put our public through this. The queues for the remdesivir, queues for the tocilizumab, queues for the oxygen. Already there is a lot of suffering in the people. So it is best to avoid such kind of confusions and such kind of medical related issues. So a lot of efforts have gone into arranging the whole thing, and I must say the situation is far better now. Although it will take a little bit more to settle the issue, settle the whole thing, the so-called the use wave, uh, in a manner in which the entire humanity or entire India or entire world would like to see. But it's on way. If the wave took us by surprise, then the only way we could have tackled it is by resolving to fight it out, and by arranging the suitable mechanisms, suitable system changes in place. And I'm happy to say that uh, whatever best we could do, we are trying, and we are still trying. Thank you.
Thank you, Dr. Kumar. I know this has been a challenging time for all of you. India is a big country, and I can't even begin to imagine how you all have been working on dealing with this. Let me turn to Dr. Arora. She, as you know, is the Dean of Maulana Azad Medical College. And as she had pointed out last time, the hospital attached to Maulana Azad is the largest hospital in New Delhi. So Dr. Arora, there are a lot of new listeners from last week. So if you can give your perspective of how things were over the last few weeks, and where you see them going now.
Yeah, thank you very much for having me on the show. I just want to say that we are really, really going through a horrific time. And as Dr. Sunil said, that we had a good time till February, March, and suddenly from April onwards, the cases started going up. We had the positivity rate, at least in Delhi, going on to mid 30s, 30%, 33, 35%, which means every 1 in 3 people was positive. And this was the second wave. And you can say maybe, it was not properly planned or maybe not expected. It was like you're caught unaware of. And a lot of things can be talked about. But now things are being mended. We went through oxygen crisis, which has been sorted out. And he already said that India is a large country. There's a lot of diversity. The protocols for management of patient are different they vary from place to place. It's a rural belt, which has very difficult way to manage the whole COVID crisis. Though I would say in metros like in Bombay, Delhi, the wave is getting controlled. Like today's positivity rate in Delhi was 11.73%. So which is like a victory coming down from 33% in 2 weeks. One has been able to get down, but that's not enough. We have to work harder. In the first wave, positivity rate maximum was up to 6%, 7%. And so here it was such a situation. Lots needs to be done, but we are coming on the track, and systems are like being mended, coming into place, and I'm very hopeful that things will get controlled sooner. Maybe Dr. Daga can further throw light on that.
So before I get to this, so some people may not exactly know what positivity rate means. Can you just explain what positivity rate means?
Positivity rate means that of the number of tests which were done. So for that, how many were positive, for COVID. So that's how we calculated the.
We mean
Go ahead.
that would mean RT-PCRs.
Yes. Yeah. This is
primarily in terms of the RT-PCR.
Yeah.
Right. So, the higher positivity rate means that if you get 100 people and it's 25% means the prevalence of the disease is a lot more than it's a good sign when it's coming down with the number of positive of the number of tests you're doing. The percentage.
Yes.
Dr. Daga, you're in the thick and thin in the ICU. So you've seen the worst of it along with Dr. Balaji. I mean, we, as a cardiologist, I kind of consult on some of these patients, but you're really taking care of the ventilated patients. So tell us your perspective of things. And thank you for joining us. We can't hear you. You are mute.
Thanks again for you calling me on this show. And I think, we are settling down a little bit, but still the number of patients with serious illness, the inflow has decreased a little bit, but is still there. And as we are seeing in this wave is, although the data are still not out, as we talked last time, younger patients without comorbidities also coming with significant severe disease. The other challenge we are facing is also in terms of people having got to both the doses of vaccine and still coming with moderate disease. So we are definitely getting many patients. And we, as far as possible, we try to avoid invasive ventilation. But again, we cannot wait indefinitely, and we cannot let things go out with non-invasive ventilation or high flow oxygen, and then we have to ventilate these patients. So the drug availability has improved. There are still some gray areas in terms of what doses to use and what not to use. I mean, different setups are using a little bit of different protocols when they come across a very difficult patients. So we have a lot of challenges in terms of managing these patients. But the primary point is how early we get these patients, how early these consult their primary care physician for not getting that disease to a moderate to severe stage. And if with a lot of information now through TV channels, through newspapers and all that, continuously flowing, but again, it is confined to major cities and towns. So people in rural area still do not have much access, and when they land up at our hospital, they are in pretty bad shape. It becomes difficult. It becomes difficult for us to manage. I think someone is speaking in between. So there is a big challenge still. I still find that the people are not finding it very easy to get a bed sometimes in a hospital, and especially an ICU bed. Yes, semi-ICU or HDU beds are available, but suddenly switching over a patient from a HDU bed to ICU patient bed in our hospital becomes also sometimes difficult, and we start managing them in HDU with all whatever we have, including a ventilator or so. So challenges are manifold, and I do not see, at least till next couple of weeks, further, peak going down. It started showing a little less, but what we have seen, ironically, is that the total number of tests being conducted are not increasing. They are almost similar, or maybe sometimes even less all over the country. So we're not getting the true picture. But yes, as far as Delhi is concerned, yes. In our hospital also, we are getting less number of patients getting admitted now, what we were seeing a week back. So that's the scenario.
Thank you. You're listening to EBC Radio. This is 11:70 a.m. We're also live on the web, www.ebcmusic.com. And today you can join us on YouTube live. You can go to live.heartbeatradioshow.com. It will take you to the YouTube feed. So we have a few minutes before a commercial break. We'll kind of divide the discussion maybe into three aspects. One is the logistical issues from an administrative standpoint. One would be the medical component, and third would be the social impact which it is having on people. So, Dr. Kumar, can you give us some examples of some challenges, especially with drug supply, oxygen, which the government faced, and how they went around tackling that to improve the supply of some of these commodities?
Yeah, as far as the oxygen is concerned and the drugs are concerned, first of all, I think the first challenge that I see is a clear confusion amongst the physicians. I would like to say here that a COVID appropriate behavior is lacking or missing or is required in amongst the public. If that is so, equally important, the COVID appropriate behavior and professionalism is required amongst the medical fraternity. What I mean to say, I would like to elaborate on this is this. This is our responsibility as the central government is to produce a national guideline, and these national guidelines are produced for a purpose, with an idea that uh, the the oxygen demand will be this much, the requirement of steroids or the requirement of ivermectin or antiviral drugs or indications of that are these. And similarly, you we talk about the ICU beds or oxygen beds, etc., etc. So logistics, broadly speaking, we talk about the logistics and their indication and their utilization. So there is some kind of a attempt to streamline the whole thing. Now, when we do not, as physicians, as the doctors, when we tend to digress from those, and we tend to bring in our own personal feelings into it, that no antiviral works, no tocilizumab has to be arranged, this patient is too sick, and the evidence is kept aside. As a result, what happens is that there is a lot of panic thrown into the whole thing, and the chaos is thrown into it. And what it does lead to, for every patient I take as another one attendant getting affected, and that person going in the markets into this in search of medicines, in search of oxygen, in search of any other thing, is further spreading to the other persons. You see, it's like this itself is creating a pandemic, I must say. We talk about creation, we talk about variants giving rise to this problem. We talk about lack of COVID appropriate behavior giving rise to this kind of a problem. I feel that this is third area which is also giving rise to a spread of infection amongst the masses, because they were running around here and there. So when our request went to the medical fraternity that, so you say, try and stick to the guidelines as far as possible. Do not try to generate their own guidelines. Then we try to look into the demands actually, that to how much is the actual demand. We try to calculate it. Yes, there was a load on all these things. There is no doubt about it, that the things were much more in severe form this time. So therefore, the demands were much more than what could normally be or let's say in comparison with the first wave. So that was another challenge, as to first of all estimating that much as far as possible accurately, and then meeting the same. So, and it does take time. You see, any challenge which throws up, which comes up, it does overwhelm, especially the medical problems which overwhelm India. They would definitely challenge us, and they would definitely overwhelm. And this particular pandemic, which has definitely overwhelmed us, challenged us. So this was, in particular, very difficult to understand as to if very difficult to not difficult to understand that if chaos is added to it and the panic is added to it and the inappropriate responses from the medical fraternity is also added to it, it will be much more difficult to control.
So I'm going to just,
when
we're going to go live.
Yeah.
We're going to for a commercial break in a second. So I'm sorry to interrupt you. And for listeners on the radio, we're going to come back right after this commercial break, and we're going to get so.
/health/VAX/FACTS.
So we're still live on YouTube. We're still live on YouTube, and I think you bring up a very pertinent question, and I'm going to let Meena and Dr. Balaji kind of ask some questions at this point. But I think the point you're making is the science being followed, where guidelines are created and people are giving the appropriate treatment rather than looking for treatments which still have not been validated. We discussed this in the last show also, and there were some questions with reference to that. And I think that is a very a valid point. So,
Dr. Kumar,
on that subject, Meena, do you want bring up something which is relevant to our guidelines and how you see them and what we should be doing? And we'll let Dr. Daga and Dr. Arora weigh in with that.
I think the dramatic change that they mentioned, that the positivity went from 33% to 11% in a short time of 2 weeks. So some of these guidelines are percolating down to people and physicians. So I just am curious to think, what do you think, Dr. Arora, that made that dramatic change in such a short time?
Lockdown. I personally look at it. It's the third or the fourth week of lockdown. I'm now forgetting. So the effects are evident now. As Sunil has already said that, with COVID appropriate behavior. So, first 2 weeks, one was just in the aftermath of the whole problem. But at least in Delhi, it is a national, I personally feel what we need is a national lockdown, which is not there. It's a state-wise lockdown. And to an extent, it has controlled. I wouldn't say completely. So, people are not going out, they're not meeting, so they are not transmitting the disease. But we can't stay in lockdown. And my hunchback is that the moment this is open, you just come back to square one. That's what I'm most scared of. And we really have to think and how to combat and not let it come back to the same situation. And we probably can have a discussion on it on the vaccination bit in the latter part of this show. But maybe Dr. Daga could add to it that what does he think in getting the positivity rate down to this level?
I think I fully second what you said. It's the lockdown after 2 weeks. On third week onwards, we started seeing some effect. 100% it is lockdown, which has helped a lot. And, and then further they made more stricter after 2 weeks. Even they stopped metro also now. So the metro service is completely stopped. So that has definitely helped. There's no doubt about that. And to the point that, yes, there were, physicians not following guidelines and in terms of drugs and creating panic. It was much more created by the social media, by television channels. And there was certainly people were in distress. You may have demand for tocilizumab, but demand for oxygen is not panic. That's a real problem government could not manage. You may not anticipate it, but we could not create facilities in 1 year to provide oxygen at the hospital level. So whatever projects were ongoing were not taking place. So you cannot put the complete blame on the people or physicians. The government has to own responsibility. And if you can't create, you can't provide oxygen, you can't blame. I mean, people started hoarding oxygen and oxygen cylinders because they knew they might need it any moment. So all that kind of thing of black marketing of drugs and all that, yes, to little extent, maybe physicians demanding it. But physicians do not have much options. They would try the drugs which have been tried, may have not shown good results, but it does call for the patient, the individual patient is individual patient. You cannot generalize it to everyone. So I would put more blame on the administration rather than on the people or on the doctors for that. I'm very upfront about it.
No?
So
Yeah.
Yeah.
If I were to add, now at least if there's a stricter classification on the hospitals, like these are the hospitals only for mild cases. These are the hospitals for moderate cases. What happened in the first 2 weeks that everybody in the mild, moderate would just come to the same, the tertiary level facility. So the resources were getting exhausted. What I believe what was done in Bombay, the commissioner has tried to sort it out by really like having a centralized way of admissions. So they have a proper call center over there, doctors monitoring the whole thing. So that's a mild level goes to this hospital, moderate goes to this level. So they've been really proactive in controlling. Yeah.
And
So
also,
Yeah.
like last time we had COVID care centers, which all were shut down in the schools and all that because they were not functioning for more than 6 months now. So those should have also started immediately, moment the wave started this, so that at least a small number of patients can go there rather than coming to the hospital emergency and casualty out of panic, a lot of patients would come there. So there was problem. People were also not following the behavior, COVID appropriate behavior. But again, all these things came too quickly and too suddenly, probably because we let down our guard at all levels.
No, I think that's very important that you just said it came all of a sudden. You see, this is a very significant and important statement. And it just simplifies the whole thing that we can't be having the things which were not required anymore and continue to stay there just because we never knew that it will come so suddenly and so acutely. So therefore, it is not appropriate to say that we were actually caught unaware also to some extent. Although we, and furthermore, what I can say is that hindsight is all hind mirror is always gives you a better, it's very easy to say that this went wrong, that went wrong. But let me ask any one of us who could say that, look, in February, March, we must prepare ourselves and come back to the COVID care centers. Did any expert tell us this? That let us rebuild the stadiums, let us rebuild the COVID care centers, let us rebuild, let us make a center like in Mumbai. We can't. You see, what happens is that when we think of that things are moving down, automatically people think that, okay, difficult time has passed. And a human being as a social person always wants to enjoy the liberties, always wants to socialize. In India, socialization is to an extreme extent, and it is very difficult to check. I would check on you, you would check on the third person would check on the other. So we are so intimately. I tell you one more example. When we have breaks, we tend to gather together and have our lunch or have our tea or snacks together. Now, this is not seen anywhere else. This is a typical socialization behavior, and it is the key to spread of infection, I tell you. It is the key. What is lockdown? Lockdown is an extreme form of a forceful implementation of COVID appropriate behavior. That's it. But why would society would want to compel the government to place the lockdown? We know that what were the miseries the people faced last year. So the governments were careful in putting down clamps, believing that you and me will behave in the way we are required to. We are also observing that the wave is coming, the infection is rising. Why don't we? And there is a constant plea that please do not go in the public. Please go only when it is necessary. Did we really follow that? You see, so those are the kind of things. And then when the things are out of our hand, when the gin is out of the bottle, and then we try to put it back in the bottle, it's not possible. It's not one-sided game. It's the public is equal partner to what has happened. Yes, the preparation is mandatory on part of the government, but why prepare? Because the public will require it. But why should the public require it? Public should require it in hoarding, for example, oxygen. Mild cases do not require any oxygen therapy. Why would you like to go to to take the cylinders in the home? Why would you? No, why we should not? So the same way, like we have to be responsible. We tend to, these are the kind of things which add to the confusion and panic. And it's not everything related to the social media or the news channels. People, these things have happened in reality. And I must say, I used to get call, arrange a cylinder for me, please. I said, what for? If you require a cylinder, I would direct you to go to a hospital. Please go there. It can lead to explosion in the homes. How would you open it up? How would you make sure that it is not being misused? How would you make sure that a cylinder which is supposed to run for 4 hours is not run out of in 2 hours?
We have
It's
Dr.
not
Balaji.
simple mathematics.
So I think you make very valid points. Obviously this pandemic has taken the whole globe, and it's not only in India. Even advanced countries, US, Europe, have all faced similar kind of the breadth and width of this whole pandemic has just taken everybody with a degree of surprise, and it's taking everybody time to fall in line. Dr. Balaji.
Thank you, Dr. Kumar. One comment, I agree with you. Government is made by the people, and what people are doing affects government. I myself have a group of my school is 105 participants. People just forward a lot of things and there's a lot of panic. I have two questions. One, what is government doing educating on the right guideline to people? Because I see 100 guidelines and either some flyer, something you are doing. Number two, the second question is that what people are asking is that we have learned from US that there is good communication by the government to the people. Are you doing a similar, are you having communication? Are you doing weekly briefing or a monthly briefing, expecting, hey, this is how we expect? Are we having a prediction that they're saying, that, okay, we expect the wave to go up or no? Are you doing anything like that?
Well, first of all, your first question that the guidelines, with respect to the availability of the guidelines to the public. In today's technology, except maybe in remote areas where the public may not be aware of what is an internet. In fact, what has happened is, if it may not be wrong to say anymore, that it will be completely wrong to say anymore. I do not have the statistics to say all this. However, what we watch today is that it is the cities which are overburdened. People have left the villages and come into the cities to look for the jobs, employments. So actually speaking, it is very difficult to find labor nowadays in villages. So all the India is nowadays sitting in cities. They are living in cities virtually. And their cities are overcrowded and the social amenities are of course strained. So what I'm trying to come to is that Even the public who is living in the villages, our villages may not have grown so well. So therefore, availability of the information to those villages who are still living in the village background, true village background, is definitely poor. But the infection was not there at that time. Infection was mainly confined to the cities, urban areas, where everyone is aware of what is going on with TVs. We may not have a bread to eat, but we have televisions in the houses. We may not have a pocket money to hire a taxi, but we have a mobile set, which is a smartphone. Every one of us has it now today. India is the largest user of the mobile sets and the mobile technologies. There's no debate about it. So everybody knew, and the news it comes in the newspaper that the so and so guidelines are available. They are available on the website. So the guidelines, and there were not multiplicity of the guidelines, I must say. The guidelines for the home care were very simple, and there is only one. There is one. It is the treatment guidelines which were, everybody was trying to put up a race. One institution is producing it, then to copy that. Oh, we are no less than that. Why should I be left behind? Another institution is producing that. So it became a kind of a like a competition with each other, that if you can do this, I can do it better. So those kind of guidelines. So that's number. So as far as that is concerned, the guidelines with respect to the home care and the mild cases, there is only one. I have not seen the multiplicity, and they were available reasonably to the people. With respect to the second question, our responses, our responses, our responses were typically, I must say that we never anticipated this. I must say, no scientist predicted it. No scientist predicted it that this will happen. Now we talk about the third wave coming up, but who knows? Third wave will come, and when it will come. Now it is a hindsight that we say that, okay, second wave has come, so we should have a third wave also. We can have a third wave also, but it should not frighten us. What it should do is it should be used as a challenge.
So let me just remind our listeners, you can call us live with any questions in 732-297-9886. You can use the same number to send a WhatsApp message, and you can also ask questions on YouTube Live. You can go to live.heartbeatradioshow.com, and that's the YouTube feed. So I'm going to just change the direction a little bit from the administrative side. So some medical questions which people have asked, and let's dwell a little bit on the amount of steroid use. There were some questions which got asked during this week to be posed to this panel. Is the amount of steroids being used out in the community appropriate, or is there an excessive use, and is it leading to some issues which we didn't expect? Dr. Daga?
It's a very good question, and I think that's what we are noticing in last 4 weeks or so. Here comes the role where we still do not have a strict drug regulation. Over-the-counter drugs are available. And unfortunately, many systems of medicine, and there are people approaching people with non-allopathic system for this disease because they are their primary care physicians for years. So that still has to change. So when they go there, the prescriptions which I get are really very, very disturbing. So what we've noticed is that a lot of people were given small doses of steroid in very beginning, within first 2 days of onset of symptoms without any need, or some of them were given large amount of doses which was not needed, with the guidelines available with the doses required. So that was a big challenge here again, because you can buy it on the counter, anyone can prescribe you, no one checks whether prescription is okay or not. And that's the major issue we have, and still we will have to work a lot on that how do we regulate these drugs, except some drugs, all the drugs a person can buy, whether antibiotics or steroids or NSAIDs or anything. That's a big challenge.
This is what I said right in the beginning, that there is no uniformity in treatment, So one has seen that steroids being misused, started at wrong time, high dose given when not needed. I mean, a lot of those things have happened out of panic. Rather, there was a time when, everybody said Medrol, which is methylprednisolone, which was being used very widely, different doses given. A time came even when that medicine was out of stock. People were hoarding it. And overuse or misuse of steroids has led to, another situation coming up is of a mucormycosis, which is the fungal infections of the sinuses, and leading to another thing which is coming up, because overuse of steroids, immunocompromised situation, diabetes coming up,
Yes.
oxygen being given in, not so clean place. And so we are going on for, I would say, another problem. It's the man-made problem.
To
Dr.
add to
Balaji,
this,
Dr. Balaji.
Yeah, Balaji.
Okay.
Balaji,
Let me ask this question, Balaji, and then you can. When, as an intensivist, you're a critical care, when do you see the role of steroids in the management? So somebody gets infected with COVID out in the field, and this is for the community which is listening. In your mind and in your practice, when is the appropriate time for use of steroids?
NIH guideline, CDC guideline, WHO guideline, everybody says you only give steroids that to 6 milligram of decadron for maximum of 10 days if you're hypoxic, if you're consistent hypoxia. Before that, there is no need for it. And now, like you said, because of this man-made, what I'm getting is a lot of people looking for amphotericin B. That because now they are mucormycosis and there's a huge shortage of ampho B, because you just took steroids when you are not that sick, or you took the steroid for longer than duration, and it has now become a challenge. And ampho B has so much side effect that we generally don't even give ampho B, but now ampho B is the only drug. And do you foresee more problems in that, Dr. Kumar, in availability of ampho B? What do you think?
Dr. Kumar.
Well, thank you very much. I'll come to this question which Balaji has posed me. Just reiterate what Ritu and Dr. Daga has suggested. I just wanted to say, re-emphasize the whole thing. You see, public COVID inappropriate behavior, physicians COVID inappropriate treatment. You see, and of course, on top of it, the public is going in and buying the drugs over the counter. Who is giving this 14 milligram, 50 milligram of steroid? It is doctors, not the nurses. So that's completely unacceptable, inappropriate. Nowhere in the guideline. And now touching the point of Dr. Balaji. Yes, I have taken a stock of what's happening with the mucormycosis. And I have a group of experts with whom we definitely take a regular meeting. And we found as when the reports of mucormycosis started coming, we looked into it, the whole thing. And we found that our experts said that the problem is 1 in 1,000, number one. Number two, it is a completely preventable problem. Number three, we came to a conclusion that number of, the treatment, the number of vials or medicines required is this much. And we have given the assessment to the regulator, to the government, who is responsible for ensuring that that much is available. And then amphotericin B is being arranged to the various states through our mechanisms, so that the treatment of the requisite type or by the requisite drugs is available. Number one, it is completely prevented. So we have issued certain warning signs as well as guidelines with respect to how to avoid it, how to pick it up early, and how to ensure that it is not being missed. So those guidelines have also been released. And the important thing is that, yes.
There is a question for you as well as for Dr. Singal. During our COVID wave, we saw a lot of cardiac issues. people already, because there's the stress of all these things. Do you suspect that you will have a lot of cardiac disease and stuff now that you had infection mucormycosis? How you look into, and Dr. Singal, what experience you have had with cardiac and COVID? Something if you could throw light on.
Yeah, so one of the challenges with COVID as we're going through this is that it has a myriad of manifestations. So it's impacting almost every single organ system in the body, and heart was not left alone. And there are umpteen number of people who would have an inflammation of the heart muscle, which was then leading to release of these enzymes called troponins. And it was hard to tell if somebody was having a heart attack or it's an inflammatory response. Over time, we realized that most of these people were not having heart attacks because that's the same enzyme which is leaked when there is a heart attack. Since this started, we've also seen a large increase in number with arrhythmias and palpitations. I still have patients coming to see us several weeks out of COVID infection, complaining of fast heart rates, atrial fibrillation. So there is a whole host of symptoms as well as presentations. There's recently an unfortunate event where there was a very prominent physician from New Jersey, who went to India, got COVID. The treatment he was getting, he wasn't happy. In fact, he was an infectious disease specialist, was in the hospital for 3 days. This is secondhand what I had heard. He left the hospital and unfortunately died because of a heart attack right after getting that COVID infection. So the COVID creates this whole state where there is increased clot formation, and that's also impacting the heart. So not only is that inflammation causing problems, causing an increased risk of heart attacks, as well as a whole host of arrhythmias. So it's been an unfortunate problem. It's impacted, and we've been learning and adjusting to it as we go along.
Dr. Kumar, do you expect
let me have Dr. Murthy weigh in for a minute here. So, we have about 4 or 5 minutes in this segment, then we'll be coming right back after the commercial break.
So what we have been reflecting, through this panel is this is overwhelming, COVID tsunami that people and governments will have difficulty dealing with. No one is, prepared for such a situation. And, behaviors are emotionally charged on all ends. The lockdown, we all agree, and this is our experience here and there, that, helps, manage and control the situation, at least acutely. But there are other consequences to lockdown. So from physician end, we feel lockdown is absolutely necessary. From economic ends and other ends, the government has to face other, consequences for it. So, Dr. Kumar, what is your experience, and what are the government plans to deal with other aspects of the consequences of lockdown?
That's not yeah.
No, we just have about 2 minutes. We'll go on a commercial break, but you can continue.
Yeah, I'll give a very short answer to that. Actually, this is not the domain which is in my area to talk about what measures the government will take, because I'm a technocrat kind of so I won't be able to really specify any particular this thing. However, all I can say is that lockdown is an extreme form of COVID appropriate behavior enforcement, and it is completely undesirable, even from the medical point of view, I would say. Why? Because in the lockdowns, it is not only the common people who suffer, but also people who suffer from other elective problems. They are also not able to reach to the hospital. So I think even from the medical point of view, it is not a very desirable thing. It is an unfortunate thing which needs to be enforced when we think that the people are really not understanding, and therefore they need to be controlled by that manner. Thank you.
So folks, you're listening to Heartbeat. This is EBC Radio on 1170 AM. We're also having a live feed on YouTube. It's live.heartbeatradioshow.com. You can text us messages on YouTube right after this commercial break. We're going to start taking your questions, which Dr. Balaji tells me have been coming. You can also WhatsApp us on this number, 732-297-9886, 732-297-9886. The next half of this show will be addressing your questions and also focus a little bit on vaccines. Yes.
May I add this question for the Murthy, just for a conversation till we are on a break. So we have patients with mild COVID and who the doctor prescribes steroids, and they are diabetic, and they, giving steroids will up their insulin, but they are very ill, that they can't eat food or they are not drinking water. How will a patient manage, and what advice do you recommend in managing them? Meaning, ideally, not just steroids, but okay, even if you don't take steroids, sickness basically makes your diabetic control hard. What advice would you give, or how can they manage the diabetes?
So this has been a major problem everywhere here and in India. One, especially our Indian people are at high risk for diabetes, even if they didn't have diabetes in the first place. They had that, what they think is borderline diabetes, but which can just tip over the balance very quickly. So, a lot of education and support is needed for our community beforehand. So we have a lot of physician extenders, whether it is community health workers or nurses and so on, working to get their diabetes or pre-diabetes controlled ahead of time. So that helps. And not inappropriately using, steroids, and that education about steroids, that it is not, just a magical bullet. Every drug has side effects, and this has serious side effects. And here, diabetes just get worsened so fast that even type 2 diabetes, people are going into diabetes ketoacidosis. And then there is no way to manage that at home, no way to manage at that stage. So what could have been managed at home now ends up needing acute hospitalization. Even in the last few days, we have been connecting with people in India, people connect with us, that we were trying to manage, because there are no beds in some towns and so on. How do you hydrate them? How do you give them insulin? And they're not used to insulin prior hand. And the medications that they're taking doesn't work. So precaution, prevention. So if you don't take inadvertently medication, you manage your meals, you manage your hydration, and be prepared to take insulin and know how to take insulin and have access to insulin is something we have been always teaching the community here. But we are also seeing a lot of new onset diabetes, for the first time, just during the COVID or COVID treatment. So it is a major public health issue. And about 40% of our patients are remaining with uncontrolled diabetes even after discharge, when they came in with no history of diabetes. So they're needing long-term, care. So post-COVID issues, because COVID does affect pancreas, right? Post-COVID, we are facing a lot of problem with diabetes.
Okay, so we're going to be ending this commercial break in a few seconds. We have some questions on YouTube. I have a couple of questions on WhatsApp. So why don't we use the next hour just addressing some of the questions? It probably be both medical and logistical. And I think there's an increased interest in vaccines also. So maybe both from the administrative standpoint as well as from the medical standpoint, Dr. Arora, Daga, and Kumar can kind of weigh in. Dr. Balaji, just we'll be going live on the radio. So give me like 15 seconds. But in the meantime, I'm assuming there are questions on YouTube, right?
Yes, there are a few questions on YouTube, and I will go through them.
Okay, so just
nutrition, log on to desivegetariancafe.com or call 609-269-9032 or log on to crownofindianj.com or call 609-275-5707.
The views and opinions expressed in the following program do not necessarily reflect those of BBC Radio.
Balaji, if you could just go over the treatment schedule, I mean, what should be done in the beginning? I mean, I know it's a repetition, but that would reinforce, I mean, when we have to take steroids.
We're also live on the web, www.ebcmusic.com. You're listening to a special edition of Heartbeat. We're talking to an esteemed panel, both from the US and India, and we're trying to bring you up to speed about the state of the affairs in India. We're joined on this panel by Dr. Sunil Kumar. He's the Director General of Health Services, Government of India. Dr. Ritu Arora, she's the Dean of Maulana Azad Medical College in New Delhi. And Dr. Mridul Daga, he's an intensivist, Director and Professor of Medicine at Maulana Azad Medical College. On our moderating panel is Dr. Meena Murthy. She is the Chief of Endocrinology at St. Peter's University Hospital. And Dr. Balaji Yegneswaran, he's an intensivist and critical care attending at St. Peter's University Hospital. And I'm Dr. Dinesh Singal. So I would like to thank all our listeners who are on the air on YouTube. Again, you can listen to us and see us live on YouTube by going to this link, live.heartbeatradioshow.com. You can post your messages. You can also send them to us via WhatsApp. Phone number is 732-297-9886. So once again, I want to thank everybody. And I missed your last comment, Ritu.
I just thought that just briefly, in another next 2 to 3 minutes, between Dr. Balaji and Dr. Daga, they could just go briefly over the treatment pattern. I mean, it's just a repetition, though. But at least it will reinforce, when to give steroids. I mean, that's why I always.
Sure. Dr. Daga?
Yeah, I think very pertinent. As Dr. Balaji said, no steroid till you do not have hypoxia. Till your oxygen saturations are not below 94, you don't need. In case you have some comorbidities and other diseases and your like COPD or oxygen saturations remain at 91, 92, 93, even in that you can even wait till 91, 92. So hypoxia is the only definite indication for steroids. We do sometimes may use small doses if people continue to have high fever on day 9, 10, 11, or maybe some small doses anecdotally, but I would not recommend that. So, and the dose is also very, very critical. 6 milligram of dexamethasone is good enough. If you have 100 kg or 110 kg, maybe you can go up to 8 milligram, but 6 is good enough, or equivalent of either prednisolone, which would come to around 40 milligram, or methylprednisolone, which would come to around 32 milligram. That's all. So that should be very clear. We should not be using that.
Dr. Balaji?
I agree with what Dr. Daga said. We have to just be cognizant when we use steroids, else we have complications. Steroid is a big thing. With this, let me start with some questions. With management, the first question is that in India, many doctors prescribe aspirin for COVID because they as an anticoagulant. The question comes that they want to know, post-COVID, how long should they continue aspirin? Dr. Singal, Dr. Daga, and Dr. Arora, probably you can weigh in.
I don't know. We get a lot of those queries and questions. Even people who are going for vaccination say, let's start aspirin and then let's take it for 3-4 weeks. I do not think there is any definite indication unless you have other associated comorbidities. If you have no other illness and you're not taking any aspirin, just for COVID, taking that in a mild disease is not required. If you are doing some marker with moderate to severe disease, you have some markers to indicate you have some procoagulant state or all that, then one would think of more of anticoagulants rather than an antiplatelet like aspirin. So that is my take. And continuing it for a long period, probably not required. I missed out on Dr. Singal telling about the cardiac, and we are seeing this cardiac problem in post-COVID, and lot many patients, and right now I'm working with looking into their MR and post, COVID after a month, MR, cardiac markers, doing their conduction studies also. So I'm finding it quite challenging. But having said that, for coagulant, I think that's my take on anticoagulant aspirin. Dr. Balaji, you may suggest something more.
Singal.
So from a cardiac perspective, I think from my vantage point, I agree with you, Dr. Daga. I'm not aware of any evidence that routine use is indicated. However, we see a larger segment of patients who have underlying coronary disease or vascular disease. Obviously, those patients require aspirin, for maintenance of their underlying cardiovascular disease. And then what you missed was really that there is COVID is causing inflammation in the heart muscle, which is mimicking heart attacks at times, causing arrhythmias, and all the things you just pointed out. Dr. Arora?
Yeah, I mean, I'm not the right person to comment about it, but yeah, I do know some people, who landed up with a lot of myocarditis or even bundle branch blocks. I mean, I've seen those kind of things.
So, and Dr. Kumar, I guess we don't have to worry about shortage of aspirin, right? But something we don't need, or something we don't need.
Certainly not. Certainly not.
Okay.
Certainly not.
Right, Balaji.
Okay, so maybe there is no role from our perspective, no role of aspirin.
Yeah, there is no role.
No role, but people, meaning that I would say not role. The second question with us that for our Daga and Dr. A person feels that he has COVID, he goes and checks himself for COVID, and he comes back as negative for COVID. How long should the isolation continue?
I think if the symptoms are even mild, I would suggest them to isolate for at least 10 days minimum. 14 days would be ideal, because we do find that, yes, they may be asymptomatic or they may be having very mild symptoms, just a symptom for a day of some irritation in throat and mild fever of, say, 37.5 or 38 degrees Celsius, that's all. They should isolate at least minimum 10 days, 14 days would be ideal. But that is what they should do.
I would just like to add that the
COVID come down
test,
to 10 days now.
The COVID test is not 100% specific or sensitive. So just because you have a negative COVID test does not mean that you do not have COVID. And that is something people have to understand. Just because you're negative. Anybody else want to add?
Yeah, agree.
That's absolutely right.
And one more question, which same thing. Dr. Arora, since you mentioned about this black fungus, so they want you to talk more about it, to know was it airborne, why it happens is what they want to speak about, and if you could speak a little bit more.
This is, see, earlier, if you really go to the literature, you'll see that it's considered a very rare phenomenon. They are, I mean, you see them as case reports, while of course, we were used to seeing, I mean, in my whole career, I've seen maybe 3 or 4 mucor cases as an ophthalmologist. And they were also the cases which used to come to us from ENT side, and most of them were usually diabetic and maybe had ketoacidosis or, really in moribund stage. And one has seen that. I mean, very rare, not so common. But in the current scenario, one is really, I mean, I have yet to see a case of mucor in the COVID this time. I have not seen any case, but I've been hearing about it. A lot of noise has been raised about it. And today also, when I was discussing with my ENT colleagues about this whole thing, that, I mean, we've treated so many 1,000 patients here in this hospital. How come we are not seeing the mucor here? I mean, it's just a thing. While in other part of the city, there's a lot of mucor. I'm giving my, Dr. Daga, you want to say something?
I just wanted to add, Dr. Sunil wanted to say something. Dr. Sunil, please.
Yeah, it is a regional problem, actually. As I said earlier, we have discussed this with the experts from all over India. And one of my typical duty is to discuss these kind of things and come out with the facts and take the measures to deal with it in time. So when we discussed this, it was very apparent that it is present or prevalent in various regions. It is not prevalent throughout the country. So, and wherever it is present, it has actually doubled. In the pre-COVID time, versus the COVID time now. So the problem has been doubled. So that is what was relevant in that.
I want
thing.
to
And of
add
course,
to it. Maybe I'll hear from Dr. Daga first, and then I'll add to it. Dr. Daga, you were saying something.
So let me tell upfront about mucor. I mean, we in medicine and intensive care, we see 1 or 2 or 3 cases in a month still, but most of them are, I'm talking of non-COVID times, most of them are immunocompromised, diabetics and all that. And we've been seeing, I mean, it's not that we're not seeing it. And I fully second what Dr. Sunil is saying, that Dr. Kumar is saying, that in Delhi, for some or other reason, we are still not seeing that many cases of mucor or cystis. I can tell it with conviction by talking to a lot of people in all intensivists in private and all that, because we are constantly in touch. And we are seeing very small number, but we are seeing much more in western part of our country. We are seeing some in some part of east also, but much, much less in Delhi and surrounding area at the moment.
No, but here also, Dr. Daga, I'd like to add, like there's another hospital, like Gangaram being such a big hospital.
Yeah, Gangaram.
So that's referral. That's
no,
referral.
But then ours is also referral. I mean, they have 19
no, I agree with
cases.
You. No, I agree with you. But they are not
and how come?
They
no,
even
they
have
are not lean.
They even have.
What happens is,
my take on this is that because of the irrational and high use of steroids,
no doubt
where
about
people
it.
have given 100 milligram of methylprednisolone, gone on for like 5 days, started inappropriately. I mean, that's the way I think. I mean, of course, I need data.
No, you are absolutely right.
You
are absolutely right, Dr. Ritu. You are absolutely right.
But, you were saying something?
No, I was saying that yes, Gangaram had reported even during last COVID wave, a lot of CNP surgeons had operated and all that. And as Dr. Sunil said, yes, they were getting cases from all across northern India and even far off places. So there may be, there are cases, and maybe there were critically more sick patients. So there is, I'm not saying that, but not to the level what we were seeing, what we are seeing right now in some part of the country, not that much level. And the other question what we do face is in terms of, not only steroids, when you are put on prophylactic antibiotics in ICUs, even that is perpetuating, a fungal infection. Not to say mucor, but yes, it may perpetuate other fungal. So what I'm seeing is prescription with 20 medicines. There are 3 antibiotics. There is a prophylactic antifungal, fluconazole. When patient is succumbing, it is so critical, what is the option left? There are no reports suggesting positivity of cultures, and galactomanons are negative, and a lot of those things happening. Dr. Balaji would know that. And that's what is happening, unfortunately, because of
Dr. Kumar, Dr. Balaji, then Dr. Murthy. Go ahead, Dr. Kumar.
Well, I would say that besides the irrelevant or irrational use of steroids, the other thing which is happening is the moisture. In the West, particularly in Maharashtra, because what is happening is the weather is perpetually like that, which is moisturous. So there's a lot of humidity in the atmosphere. This also gives rise to one. The second thing which I want to point out is the unclean environment in which the patients are treated or oxygenated, particularly if the water is not clean in the humidifier. That is a big source of infection, which goes unsuspecting, because it is living. It's an organism which lives with us. So it only attacks us when we are usually immune compromised. Usually, it's not even a small immune compromise. So, and as far as the regional centers, like PGI and then other specialized centers, and the word spreads by mouth. Go to Gangaram. They treat it very well. So all the cases will get concentrated in Gangaram. So like that. And this is what happens in PGI also. This is what happens in Mumbai also. So it's a unique centers which are getting all these cases. And that's how they are reporting larger number of cases. Otherwise, rest of them are still reporting that only unique one or two cases, and then they are referred to the major centers. That's how I see it.
Dr. Balaji?
You answered my question.
Okay, Dr. Murthy?
So when we are talking about, clinical situations, what I find is, if people are very sick and they are fortunate to get a hospital bed and they're in the hospital, somehow they are taken care of. People who are very mild, they're at home and they probably will do okay. But we have a large number of people who are in that, zone, almost needing hospital or quite sick and not able to get the right care or even access. So what are some suggestions or guide that you have for people at home of what can be done?
Who is this addressed to?
Anyone who is dealing with the situation in India?
Yeah, I'll take it. I'll take it. What we are facing. Let me take.
Sure.
So those who are able to contact any of their primary care physicians and all that, and that's what was happening. That yes, moderate category of patients sometimes are being managed at home. There are a lot of service providers who are setting up kind of an ICU facility at home, at least in Delhi. And there are a couple of those 3-4 organizations I know. 3-4 big hospitals have their own ancillary teams which are providing these services. So those who can afford, those who have access to that are getting care from that, are able to manage at home. But yes, lot number of patients are suffering. And they do rush to the hospitals, try and find a bed in 24 hours or 48 hours of their severity progressing and all that. And somehow or other, government is making arrangements. The bed numbers have increased now and all that. So that situation at the moment is not there in Delhi, at least. Maybe it is there in some rural areas at the moment. But in big cities, that kind of a situation is much, much more, at the moment not there. And people are getting access to the beds. So that's not happening. But yes, it was happening a couple of weeks back.
But here, if I would like to add, that there is still a shortage of ICU beds. Getting admission to the hospital 2 weeks back was difficult even for a moderate case needing oxygen. Now that problem is not there. You easily get admitted. But getting access to ICU bed is still an issue. I would put it more like that. Yeah.
Now to our next question. We just move to our next topic of questions we have is on vaccine. So let's start with a comment that when I got my vaccine in US, I got a paper card. When my parents got a vaccine in India, they sent me a QR code. It simply showed that India is more digital than what America is. Having said that, having digital means that the likelihood of error probably is lower. Having said that's a question that my grandma is 90-year-old, should administer 2 different shots because of mistake at hospital. The first time she got Covishield, second she got Covaxin. Is such thing common or it's a very rare case? And the question is that what should we do? It's very easy to answer that we do not know. And either one of them you have to give a read, was what I would say. But what do you want to add about it?
I think that's not a common thing. Dr. Sunil would definitely.
Yeah, it's extremely uncommon, I must say, and it's an unfortunate mistake. It's definitely not.
Because most of the centers have only one brand available with them. Generally,
yes.
Here
it is. No. One center, if it is giving Covaxin, it's only giving Covaxin. Another center is giving Covishield, is only giving Covishield.
Definitely. Definitely. And it probably, I don't know the details of the case, but I would suspect that probably it could have happened that they may have, changed the center to other center. And there may have been an error at that time that whether you received what kind of vaccine did you receive. So, but it's definitely not the one which I've heard of.
That is true from safety also in US with the barcoding. Barcoding error is 1 in many billions. You have errors. It would probably be a very, very low rate. But that brings to this another last question. Unless you want to go.
Sure.
Is there any guidelines on mixing vaccine with different vendors? And probably your answer when you went probably no because of what you said, but that is what the last question YouTube that came and on end there.
So on the subject of vaccines, we know this recent explosion of cases was probably due to a variant. What's the experience been for people taking care of in the hospital, and the reports from the administrative standpoint as to the efficacy of the people who are vaccinated with these new variants? Are you seeing cases with people who are fully vaccinated with this variant?
Yeah.
And how sick are those people?
Yeah, actually speaking, cases are not all that severe if they've been vaccinated. But yes, I have come across cases where severe cases, and recently we lost some doctors who were vaccinated, had got both the vaccinations. So it's a bit of a scare, definitely. And I just want to add here, last time when we were talking, that what can API further do for us? I just want, if you can lobby with your people to send us more vaccines. Because if we have to find end to the problem, what we are having, we want to vaccinate 80% of our population, and that is what is currently we are quite short of. Otherwise, we just keep going round and round.
Dr. Sunil was wanting to say something. Dr. Sunil.
Yeah.
I just wanted to say something which Dr. Ritu has touched upon, that they were vaccinated fine, but vaccination does not necessarily mean immunogenicity, does not translate into immunogenicity. We don't know those cross infections, which are breakthrough infections, which are occurring. Are they occurring in patients with the variant and the person developing immune system, or the immune system has not been challenged enough to develop the antibodies, and the virus is getting an opportunity to still attack? Because it is not the liquid which matters, it is the how it challenges our system to throw up the antibodies and fight out the virus which matters. So just physically getting vaccinated is not enough. What is happening to our my milieu, my physiology, my blood is what matters. So, but yes, breakthrough infections are occurring. If we say that they are vaccinated, if we say that the liquid was given to them, but different people react differently to the vaccine. We know it.
We also know that the efficacy is ranging from 65% to 75, 80%. So
correct.
We really,
I think that's additional.
We are doing some study, and we are looking into healthcare workers' antibodies level for last 8 months now.
Sure.
And we are finding it so variable. So we have to see the ability. I mean, they do have T cell responses, but their antibody levels are not there in some of the patients. So we have to see that.
Sure. Yeah.
Now that we are talking about healthcare workers, doctors and nurses, being sick or, getting disabled post-COVID infections, and having already shortage of providers and physician extenders, what are some of the things that are happening in the universities and hospitals and governments, to take on that challenge? It's a huge challenge.
It is a huge challenge. There's no doubt about it. We started the whole thing by opening up vaccination to the warriors, the healthcare personnel in the beginning, with this particular intention that these are the ones who will be maximally exposed, and no matter what precautions they take, they will be exposed. And on the other hand, if people tend to behave in a restrained, in a much more social lockdown kind of a situation, that they wear masks, maintain distance, and avoid crowding and sanitize their hands. So that's a social lockdown, I would say, socially appropriate behavior, if they had behaved in that way. So it is the priority was first initially the doctors and the nurses and other staff, which is, but there was a huge hesitancy. We know our own colleagues who are very hesitant to take it up, and then what we did was we tried to raise up the campaign. Even I was amongst the first ones on the day one to get the vaccinated, just to show an example that look, this is something which we must accept with open mind, and this is the only chance if we have to talk about science. But unfortunately, in India, if I'm allowed to say it in the inverted commas, and I hate to say that, uh, we are a society who believes in who goes by beliefs and not by science still. So that acceptance was not wide, and therefore hesitancy. And then we had to move down the scale, and other people had to come in. And of course, we all know the story of shortage.
We're going to go to another commercial break on the air. We'll continue the dialogue on YouTube. Again, you're listening to Heartbeat. You can tune in to YouTube feed at live.heartbeatradioshow.com. We're talking to an esteemed panel about the COVID situation in India. You can call into the studio 732-297-9886.
Mortgage rates are at record lows. If you have not reached
the next question comes out of Murthy.
So
Question.
can
continue the questions. Can you continue questions? But there's a YouTube question from a YouTube listener. She says that my mother got steroids when she was COVID positive. Now she has sugars. I mean, she is diabetic and has a lot of weakness throughout the day. What can food or daily life changes she can do to get better? Dr. Murthy, this is probably for you. Can answer the best.
Yeah. Well, I'm glad that they are monitoring the blood sugars. So, that's very important to know where the blood sugars are. Our Indian diet is very rich in starch. So if we can cut and distribute the starch throughout the day, that helps. And then, acutely, many times we have to be willing to take insulin, even though it's injection, and learning how to take it and not worrying about taking it. And, slowly you may be able to come off of it. So, but most important is to manage the starch content in the food and having good hydration with water and monitoring and working with a physician or a nurse who understands sugars and willing to take injections, if there is a need.
So I'd like to, we're going to be going back live fairly soon. And I think at some point, we need to shift the discussion back to the vaccines, because I think looking at what has happened in the US, the CDC last week changed guidelines where not only can you go without masks outside, but what they're saying is that if you're fully vaccinated, then the ability to stay indoors without masks is also there, which is a real game changer. Again, I'm not personally, just this is personal opinion, I don't know what the situation of the variants is going to be vis-a-vis the vaccinations we've had. And God forbid that there is a variant, we might see, again, an uptick in infections. So, and I know UK is also kind of trying to identify that there's a large spread of the Indian variant in UK. There are some cases reported in New Jersey. Are the variants being routinely monitored in India, when the testing is being done, or is it just sporadic at some academic institutions? Dr. Arora and then Dr. Kumar, are you?
I wish it was more. I mean, they are doing it, but lots needs to be done. A lot of regular genomic sequencing needs to be done so that the variant, monitoring becomes much better, much better.
Dr. Kumar, what's the status? Sunil?
Yes, I think that's a very important point which you have touched. And I think once again, we must talk about the science here. And the science says that what percentage of samples need to be assessed to monitor the variants. The virus is known to mutate, and it will continue to mutate as long as it is replicating. But what is important is that we don't need to monitor. We don't have to subject every sample to study of mutation. There is a definite set defined number of samples and how they are to be collected, which need to be subjected to variant study. And that India is exactly on dot with respect to that. I would definitely like to inform all of you here that those numbers are being taken care of.
Okay, we're just going to go back live on the air. So give me just 1 second.
Expressed in the following program do not necessarily reflect those of EBC Radio or its management. Please use your own discretion while making your own judgments or decisions.
Welcome back, listeners. You're listening to EBC Radio. This is 11:70 a.m. You're listening to a special edition of Heartbeat. We have an esteemed panel on a Zoom link with us, and we're also live on YouTube. The link to YouTube is live.heartbeatradioshow.com. You can ask your questions. You can call us in the studio 732-297-9886 or send us a WhatsApp message, or you can ask questions on YouTube. Our focus just shifted to the variants and the role of vaccines in preventing those variants. What's the current understanding of the existing vaccines vis-a-vis the current variants or the mutations which exist in India right now?
I think most of the epidemiologists and public health experts do feel that, yes, the current variant may cause a problem, and those who are vaccinated may not have good immunity against them. But still, the complete data are not out. So we still have to wait, I think, for another 4 to 6 weeks to know that, or maybe longer to know that. So there is definitely a discussion, and all these things are going on to find out, yes, that this may be an issue. And also the debate is going on about increasing the interval between the two doses. Already for Covishield, they're now suggested to increase it to 16 weeks rather than 8 to 12 weeks earlier. So the second dose may be given after 16 weeks. But for the other vaccine, Covaxin is still the dosing schedule is 1 month only. But that all still is not very clear.
Dr. Kumar, Dr. Ritu?
I have a different view on this, and as far as the official stand is concerned, and as far as our scientific panel is concerned, where we have across the world, across India, the scientists participating in these kind of debates and decision making. I must say that right now there is no concern with respect to the vaccine being effective or ineffective against the variant. It's being closely monitored. That's number one. With respect to the distance or the gap between the first dose and second dose, yes, it is one particular vaccine which is where we have this decision being made, and once again, the decision has been made after careful consideration of the data. There is a lot of confusion on this issue, whether a number of other colleagues and the scientists are saying that it could also be a gap of a quote unquote year between the two doses, but I am not really very sure of that. It's not my subject, but what I'm conveying, the decision is the decision which has been taken after careful studies. I'm not a virologist or a microbiologist, but the decision which has been agreed upon after the careful study of the trend, the evidence at hand, says that 12 to 16 weeks what would be agreed for.
Dr. Arora?
Yeah. I agree with what Sunil and Dr. Daga have said. I mean, by and large, my take is the same.
So, and what's the status of availability? How soon can a common man get access?
As the vaccine campaigning started from January onwards, so first this were purely on healthcare workers, then they extended it to age more than 60. Then came the time when they started putting it on from 1st of April, it was that anybody who's above 45 would get vaccinated. But from 1st of May, they said that anybody between 18 to 45 can also get vaccinated. I mean, that was a policy decision. But on ground, what we're seeing of late, that there is a lot of shortage of vaccines. Shortage of vaccines there. And I mean, every day one keeps hearing that it is in Delhi that we have vaccine for maybe another day or maybe another 2 days. So a lot more needs to be done so that the vaccines are easily available. And as I was told by an epidemiologist, that 80% of the population has to be having the immunity, and then only we can wipe out this pandemic. So much more needs to be done at that level, though the government says that by August, September, they plan that 80% of the population would be vaccinated. But a lot more needs to be done in that field. That's what I feel.
Dr. Balaji?
Something which we can learn is that in US, we still see vaccine hesitancy. Many states in US have returned vaccines back. We also know from India, we know polio is such a good vaccine we have. Still, we had to do years of pulse polio campaign. We had to ramp big celebrities, and then we got polio out of our system. Do you think the challenges that they can face once we have enough vaccine, people will have hesitancy with COVID? Or do you think everyone will come up and line up for COVID vaccine?
I think there is a lot of hesitancy with vaccine to begin with. But now I've seen ever since the pandemic has started, that hesitancy is going away. I mean, everybody now wants to be vaccinated. And I mean, I see because we have like 3 centers in my college itself for vaccination. So initially, the centers used to be quite empty and anybody could just walk in and get vaccinated. But of late, I mean, one has to wait for an hour or maybe more, get registered on the app, and there's a lot of crowd, though it's regulated, but yeah. So with the pandemic and a lot of mortality happening, everybody wants themselves and their families, especially children. They want that anybody between 18 to 45 to be definitely vaccinated. This hesitancy is going away by and by.
So, Dr. Kumar, from your vantage point, where do you see the availability of vaccines in the coming months and in this year? Because obviously India is a big country, large population, so this is not going to get resolved overnight.
Definitely, I fully agree with you. It's definitely a area where we need to work harder than what we have. And that's why we are trying to rope in many other candidates, because we need to we will have to include a variety of other candidates also. And we want them to be coming into our system in order to vaccinate all the population that we want to. A lot needs to be done in this regard. It is an area of concern, but the government is working overnight with this issue. We are grappling with this issue, and this issue is not kept under the carpet. We are aware of the situation and the steps as required in terms of emergency use authorization, lesser strict regulations, and the placement of the orders, and working with the people, creating a much more better environment for vaccine availability as well as acceptability. So all these areas we are working. And Ritu is rightly has pointed out earlier that the earlier hesitancy that we saw has almost disappeared. Now the slots are sold out. Sold out means like they are blocked within a few minutes. The moment the slots are opened up, they are absolutely blocked, because younger people are they are very, very enthusiastic about it and they want it. And therefore, simultaneously, it's the government's duty to rise up to the occasion. And all I can say is assure you that we are not sleeping over it, and we are working hard on it. We are trying to arrange multiple candidates. We're trying to place the orders. We're trying to, as fast as possible, fast track the whole issue. It remains a lot of work needs to be done. We will do it. Thank you.
Dr. Murthy?
So, post-COVID, we have COVID recovery centers here that, are quite challenging, but need a lot of care for these people and their families. What is happening in the hospitals there, or in your clinics, for managing post-discharge or in the transitional state?
Maybe if Dr. Daga talks, and then I'll take over.
Yeah. I think we started running a post-COVID clinic also sometime back in October onwards for the previous wave and all that. But at the moment in our hospital, all those services in my center are closed. But yes, there are many centers where they are running post-COVID clinics where patients can come and they are being taken care of. But I think it's still a long way to develop that facility in most of the places. But yes, individually the patients communicate with their primary care and are being taken care of. But at institutional levels, not all institutions have that. Small number of institutions have those facilities. Rest of the time, it is they're walking into any other outpatient department with appointment or without appointment. That's what happens in India, and come up with these.
I really feel there's an urgency for that. Urgent need to develop COVID recovery centers. Today only I was talking to our medical director that how are we going about developing that. But the issue comes here that all the manpower which we have in a hospital is currently busy with treating COVID patients. So here comes the manpower issue. Yeah, Sunil, what do you want to say? Yeah.
I would tend to visualize this in a much more, in a more elaborate manner. What I would like to say is that not every patient following the COVID discharge, COVID treatment needs to come to the hospital. That's number one. We should be aware of this, and we should not propagate or advise all the patients to come to the hospitals after the discharge. Very select patients would be requiring this, number one. Number two, from the beginning, I do not know, from my early days in medicine, I was of a very strong opinion that we must rope in our peripheral system. We don't have a formal family physician kind of a system, organized kind of a system, but we do have the private practitioners to whom we tend to go and have full confidence in them. We should rope them. We should rope the CGHS dispensaries and other government dispensaries into the follow-up of these patients. We should also rope up our primary health centers and wellness centers into the post-COVID follow-up. And so these are the areas we need to work. Lastly, I am a very strong proponent for telemedicine. I think a lot of telemedicine, every district, India should aspire to develop one telemedicine center. And these telemedicine centers can do a wonder with respect to mild cases, those who are in the home care. And therefore, post-discharge also is home care only. How you see it otherwise? Post-discharge also is a home care. They can be guided there. They can be guided about psychological trauma. They can be guided about nutrition. They can be guided about the exercises. They can be guided on the when to come to the hospital, when not to come to the hospital, etc., etc. So telemedicine center, if India develops one telemedicine center per district, I think we'll cover a lot ground. And I am very keen to see one day, and I am already proposing that. And I think we are already working on in this direction slowly and slowly. That's how I see it. Post-COVID sequelae, not every patient should be advised to come to the hospital. We can always divide them, yes, but they need to be taken care of.
In the same line, do you think does everybody need a doctor? And some part of the doctor's job can be done with people like for nutrition, a nutritionist, or some physical therapist or something, because you don't need to train somebody to a physician level and then make them do, or have you thought like that way?
I think, Dr. Balaji, what we were talking about was patients who got discharged from hospital.
Discharge, yes, post-discharge, more psychologists.
But majority of the patients, as Dr. Sunil said, would not require anything, all COVID patients, yes. But those who are discharged with moderate or severe disease and were in hospital for 10 days, 12 days, 15 days, associated comorbidities and other things, what is their outcome and their follow-up, they would definitely require a doctor's opinion, maybe one or two in next 8 to 12 weeks, and after that doesn't matter. But what we require, as he says, is about a lot of counseling, a lot of those nutritional support and all that. And so we are hearing of that telemedicine developing in this country for 20 years, but I've not seen anything of that kind working at the moment. It comes in pieces and meals. So
it works extremely well.
Yeah.
We found that extremely effective to coordinate the healthcare personnel who assist, whether the multidisciplinary team still needs a physician leader to coordinate, but telemedicine works beautifully.
And as broadband spreads, I mean, this is an example. I mean, I've been doing this show for 18 years, right? In the last 2 weeks, I've been able to now connect with people from overseas, stream this on YouTube, and that's all it really takes. You need a physician on one side, and you need so at least technology is allowing those challenges we were having before, which were there. And I think as broadband spreads, it's going to. Dr. Kumar, you have, and then Dr. Balaji. Sunil, you.
Well, I just wanted to one more thing. Continue in the same direction. Was this that I'm happy to inform you that as Director General of Health Services, I am opening up myself. My office is opening up a telemedicine center, and I have already started the ball rolling. And maybe in a couple of days of time, right now, we'll be kicking an alive telemedicine center under the office of the DGHS. That's number one. Number two. So what I'm trying to say is that how passionate I am. That's how that's the measure of passion I have for this. Number two, I think if we can, one more area where we can work. I'm digressing from this point, from your point, but I must emphasize here that India needs to work a lot in pre-hospital care. If we can do wonder, if we can improve two areas, pre-hospital care, which includes the preparations, the trials, the pickup, and the en route care, and the information to the hospital notification. If in this particular area, if India works, this is completely lacking an organized sector. If we work in this particular area, and it's time to work in this area, we will have absolutely fabulous medical system in place. And my vote, if I have to pick up one particular item where I would like to work, and the government or outside the government, that's the area I would like to hit.
So, Dr. Kumar, this is something from a couple of things. So this part 2 of the show. So last week, Dr. Arora had spoken about the people not knowing which hospital has beds. From this week, we also realized that the third wave can occur, is what you said. It may or may not happen. Is there anything technical? Since India is the IT hub of the world, as a DGHS, are you thinking that in the third wave occurs, are you preparing that the family members don't have to go from hospital to hospital? Can they have an app or a technology by which they know which hospital they have to take? Okay, you have mild disease, you go to this place. If you have moderate disease, go to this place. And serious disease, don't go to 5 different hospitals. I had family members who have had friends and family members who are waiting in a hospital company for another hospital. Have you looked into anything in that aspect?
Yes, I think that's a very important question, and I take you back to one particular thing. It's just about the confidence which I have. I'm just trying to tell you about that. In February in 2020, while I was struggling with the problem of riots in Delhi, my hospital was dealing with the riot cases in Delhi. And that time we had a meeting. I won't tell you the location where exactly it happened, but a very hi-fi meeting where we had a first meeting with respect to the COVID. And I'm not trying to boast about it, but I said in that meeting that we are sitting on a ticking bomb. and we at that time there was virtually no cases reported in India. But I do not know what my gut feeling was. I said we are sitting on a ticking bomb, and I wouldn't say that my what I foresaw has come true, so I'm very proud of it. No, it is an extremely devastating problem which we have faced, and all of us have suffered. My people have suffered, and therefore I'm not really very proud of what I said has come true. But what I'm trying to say is that even now we have learned a great lesson from the second wave. And in terms of the preparations, like what you mentioned just now, that preparing the dashboard is preparing the technology, preparing the interconnectivity, the real-time availability of the HR, the consumables, the bed, the oxygen, the drugs, the ICU beds, the ventilators, etc., is being worked upon. And God forbid if third wave comes, my feeling is that we will be in a better position to fight it out, barring the pre-hospital care, which has not been looked into. And that is one area which may still defeat me as the government. I wish I had also, we could work on that also area, but it's a tremendous area to work upon, and it would take about significant time.
So
Thank you.
believe it or not, the 2 hours have almost flown by. We have about 3 minutes left. One, I just wanted to tell you that somebody did send me a link. There are some technocrats who've put together an app similar to this. I'm going to post that link in the YouTube link, where actually if you click, you can get the current hospital status in different cities in the country. So apparently that exists. 20 seconds from each of the panelists to give their final thoughts as to what direction they see COVID going, and then we have to wind up with the show. So let me start with Dr. Kumar, Ritu, Dr. Daga, and then Meena and Balaji. So just 30 seconds. I don't have much time. So
Yeah.
what do you see?
How I look at it as a combination of COVID appropriate behavior by the public and some measures, appropriate measures by the government, and a huge preparation by the government in terms of beds, oxygen, ventilators, and information to the people. And that's how I see it. Third wave may or may not come, but we'll be in a better position to fight it out. We are already doing reasonably well now after the huge challenge the second wave threw, but we have been able to now reasonably control it, and people should have confidence in us. Thank you.
Thank you. Dr. Arora?
Yeah, and I just want to say one sentence that we're on the right track, so that we were able to control it quite fast, but it's not over. We can't relax. COVID appropriate behavior is there to stay for long, and vaccines need to come so that we can be over with this challenge.
Dr. Daga? We can't hear you. You're mute. Can you unmute yourself? Dr. Daga, you're muted.
You need to unmute.
Okay.
Yeah.
So what I feel is that, yes, let us not be complacent, but I am concerned of its spread in rural areas now. What I'm going to see now in rural areas is kind of devastation which we have not seen. And we are lacking in health infrastructure. I wish that the primary care health structure in this country is created to a level what is existing in some states like Tamil Nadu and Kerala. When we have examples, why can't we replicate everywhere and then link them with through the IT? That is the most important thing we have to do.
Thank you. Meena?
We are very appreciative of all of you doctors, what you're doing there. And we are here, and we need some guidance in channeling the energies and resources from outside. So when you're planning your care, you can also think about that. And thank you for what you're doing.
Balaji?
Thank you for coming. COVID is a very small virus, and the humans are resilient, and I'm sure that we can overcome it. And if we just follow scientific guidelines, and we'll do that.
So with that, COVID has changed our lives in many different ways. We've learned a lot. There's a lot to go. I don't think this is going to be over in the foreseeable future. With that, I thank all of you, Sunil, Dr. Kumar, Ritu, Dr. Arora, Dr. Daga, Meena, Balaji. This was an amazing session. We hope that our listeners learned something out of this, and I commend you for your dedication. With that, hopefully everybody will stay healthy. Let's get all vaccinated. Let's take care of our patients. Thank you so much.
Thank you. Thank
Good
you very
night.
much.
Good night.
Good night, all. Thank you very much.
Thank you.
Bye.
This is Complete Security calling to confirm our appointment for tomorrow morning about 9 o'clock to update the radios in the building.
I'd like to thank St. Peter's Healthcare System, treating you better for life, for sponsoring the preceding program of Heartbeat Show.
बड़ा आसान है ये समझना कि हम जीत गए हैं, लेकिन अब भी बहुत समय बाकी है। अगर आपने